This is Radio Health Journal. I'm Nancy Benson. This week, kidney disease. Most people who have it don't even know it.
It's not until one has very progressive disease that people can begin to experience signs and symptoms.
How to stop the silent march when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics, from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
You could buy bottles of tincture of cannabis from the big drug companies like Eli Lilly.
A brief history of cannabis and its introduction to the U.S. market. Then,
when you get the diagnosis of dementia, it is kind of terrifying.
An intimate and hopeful memoir of coping with Alzheimer's. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station, and subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Our kidneys don't get much respect. They have the thankless job of cleaning waste products from the blood. Unless something goes wrong, most of us hardly ever think about our kidneys. But maybe that should change. It could make us a lot healthier.
Chronic kidney disease is a serious condition affecting more than 37 million Americans in the United States. That's about 15% of the adult population that has chronic kidney disease, and of them, close to 470,000 people in the U.S. are on dialysis.
However, many of those who have kidney disease don't know it, according to Dr. Griffin Rogers, director of the National Institute of Diabetes, Digestive, and Kidney Diseases, part of the National Institutes of Health. 96% of people with mild chronic kidney disease are unaware of it, and 48% of those with severe disease don't know they have it. That's because kidney disease is often completely silent.
It's not until one has very progressive disease, in the case of kidney disease, in fact, one can lose up to 75% of your kidney function without having any demonstrable signs or symptoms. It's only when you begin to encroach upon that remaining 25% that people can begin to experience signs and symptoms. Symptoms being fatigue, excessive tiredness because of the kidney's vital role in removing extra fluid retention in the body. It's also very important to maintain electrolyte and mineral balance, potassium, sodium, calcium, phosphorus. And because of the vital role that those minerals and electrolytes have with essentially all of our tissue function, including the muscles and the nerves and heart and brain and other things, that one begins to experience symptoms related to those tissues in extreme circumstances.
One of the major factors behind chronic kidney disease is also silent. High blood pressure is outranked only by diabetes as a cause, and Rogers says it can do major damage, though you may never feel a thing.
The blood pressure being very high can cause stress to the small vessels, cause them to stretch, and over time actually be damaged, that the kidneys function to filter blood, remove waste and extra water to make urine. If these kidney blood vessels are damaged, they may not be able to properly remove waste and the extra water, which can ultimately progress to kidney failure. In addition, there's actually a reciprocal relationship. So as the kidney filters are damaged, the kidney wants to maintain that blood flow to the kidney, and so the kidney produces substances which narrow the vessels even more, which can actually lead to additional kidney vessel damage. And so one can see this vicious cycle occurring.
That's why during March, National Kidney Month, the National Institutes of Health is pushing for people who know they have high blood pressure to take care of it, and for people who don't have high blood pressure to keep it from getting that way.
If they know they have high blood pressure, the best way to prevent the disease is to take steps to lower the blood pressure by taking medications as prescribed. There are actually two types of blood pressure medicines called ACEs and ARBs, classes of medicine, that not only lower the blood pressure, but they also can slow the progression of kidney disease. And the doctor may prescribe other drugs that have effects on the blood pressure as well. But I think general recommendations that the doctor is likely to make is to aim for a healthy weight. Particularly if you've been diagnosed as being overweight or obese, even losing a small amount of weight, say 3 to 5% of your body weight, may improve your blood pressure readings as well.
Rogers says changing your diet can also help lower blood pressure.
Eating more fresh fruits and vegetables and lean meats and whole grains and heart-healthy foods. Most people should try to keep their sodium intake to no more than 2,300 milligrams per day, and that's why it's important to read food labels and shopping around for alternatives with less sodium. And if you smoke, you should quit. Smoking also can damage blood vessels and raise a chance at high blood pressure and worsen problems related to the high blood pressure. And then one final thing that's often neglected, but I'd like to mention, is I know it's hard, but aim for 7 to 8 hours of sleep at night. Sleep and getting sufficient sleep can improve not only your blood pressure readings, but maintaining a healthy weight, maintaining a healthy cardiometabolic status, and can improve stress. And so it really has many beneficial effects.
Rogers says all of this advice is even more important if you're in one of these groups that has a high risk of kidney disease.
People who have diabetes, for example, and a substantial number of the people, there are more than 100 million U.S. adults who have either diabetes or prediabetes, and that rate is rising. And so diabetes is a major risk factor for kidney disease. If kidney disease runs in your family, then you're at increased risk. If you're over 50, if you have on certain medications on a chronic basis, people who take a lot of non-steroidal anti-inflammatory drugs like Motrin or Naproxen, for example, those drugs taken at high doses for prolonged periods of time may damage the kidneys, so they may be at risk.
Those same groups may also want to be sure they're tested for kidney disease, since, as we've said, the disease is silent. The test should be part of an annual physical.
It is frequent that blood and urine are tested normally. The blood is tested to determine how well the kidneys are filtering blood. The urine test will detect the presence of excessive protein in the urine. And even though the kidneys are responsible for filtering out waste products, the one thing that it should do, if it's functioning properly, is to retain important proteins in the bloodstream, like albumin, for example. And the presence of high levels of albumin in the urine is a good indication that there may be damage to the kidneys that have occurred. So that's usually done on a routine basis, but if not, then we would suggest that your listeners be more proactive and actually ask our providers, are you testing for my kidney function? And if you have, what are the results and what should I do about it?
You can find out more about kidney disease at the National Institute of Diabetes, Digestive, and Kidney Diseases website, niddk.nih.gov, or through a link on our website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
Most primary care doctors expect to see more people with dementia over the next 5 years. But a new survey shows half of them don't think the medical profession is ready. Primary care physicians are on the front lines of dementia care, but nearly a third are never or only sometimes comfortable answering patient questions about it. Nearly 2 in 5 say they're never or only sometimes comfortable making a diagnosis. That's deeply concerning to Dr. Joanne Pike, Chief Program Officer of the Alzheimer's Association.
We're heading toward a medical emergency when it comes to ensuring dementia care will be available for all who need it. It's critical that stakeholders work together to reverse the shortage of dementia care specialists and enhance dementia care education for primary care providers.
The survey is part of the Alzheimer's Association 2020 Alzheimer's Disease Facts and Figures Report, which finds that, barring medical breakthroughs, the number of people with Alzheimer's dementia may nearly triple in the next 30 years. Find out more at alz.org.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.